Hallo und herzlich willkommen zu unserem Podcast Von der Wiege bis zur Bahre, der Podcast für alle Alltagsheldinnen und Alltagshelden im Sozial- und Gesundheitswesen. In diesem Podcast erwarten euch spannende Interviews mit Branchenexperten, die euch Einblicke in ihren Berufsalltag geben und ihre Erfahrungen und Methoden mit euch teilen, die ihr anschließend sinnvoll in euren Alltag integrieren könnt. Freut euch auf Einblicke in die Welt von Psychologen, Psychotherapeuten, Digitalexperten, Coaches, Unternehmern, Ärzten, Hirnforschern und vielen weiteren Gästen. Natürlich besteht auch die Möglichkeit, im Anschluss mit einigen unserer Branchenexperten in den Austausch zu gehen. Dazu aber mehr zum Schluss. Jetzt starten wir erst einmal und ich freue mich, unseren heutigen Interviewgast begrüßen zu dürfen.
Im Podcast haben wir heute die Gesundheitswissenschaftlerin Prof. Dr. Arlene Kent-Wilkinson. Sie promovierte 2002 an der University of Saskatchan in Saskatoon, das ist in Südkanada. Ihre Forschungsschwerpunkte sind die psychische Gesundheit, forensische Psychiatrie und Gesundheit der Ureinwohner Kanadas sowie internationale vergleichende Forschung. Arlene begann schon Mitte der 90er Jahre mit der Entwicklung von Kursen für Forensik und Gesundheit von Aborigines, erste, die zu dieser Zeit schon Online-Kurse für ihre Studenten entwickelte, also nun schon mehr als 25 Jahre digital arbeitet. Arlene forscht in einem interprofessionellen Team an der Universität von Saskatchewan, der Forensic Mental Health Research Group. Dieses Team erforscht die psychische Gesundheit von Straftätern. Arlene ist auch eine begehrte Beraterin der Politik, wenn es um die Gesundheit der kanadischen Ureinwohner geht. International ist sie eine geschätzte Expertin. Sie arbeitet eng mit australischen, nordamerikanischen und deutschen Wissenschaftlern zusammen. Arlene ist mit ihrer umfassenden Expertise ein gern gesehener Gast auf internationalen Kongressen, wenn es um das Thema psychische Gesundheit geht. Wir sind hocherfreut, Sie heute per Skype-Verbindung bei uns zu haben. Den Podcast gibt es auch mit deutschen Untertiteln bei YouTube in der Reihe von der Wiege bis zur Bahre zu hören. Okay.
Vielen Dank. Let's start.
Hi Arlene, we, that means Bildungsinstitut für Soziales und Gesundheit in form of Renate Gaun and me, Steven Grunde, are so grateful that you are facing our questions about coronavirus in Canada today. We would like to thank you very at this point. Arlene, you're a health scientist at University of Saskatchan in Saskatoon, Canada. A special honor for us today making this interview. Maybe you can tell a little bit about your work and research area.
Yes, I've been at the University of Saskatchewan since 2002, an associate professor there. My focus area is forensic nursing and Aboriginal health, and that I teach in Aboriginal health in the graduate program, and mental health in the undergraduate program is what I teach there. And let's see what to say. Next year, it'll be 50 years that I've been a registered nurse, and certainly lots of changes in those 50 years. Just a little bit about my family. I'm still working and plan to keep working for another 2 or 3 years at least. My husband's retired, and he was parole officer, was his profession. And we have 2 sons. They're 36 and 34 years old, and both married, and both have one grandson each from each of them.
No.
And my oldest son is an ICU nurse, and so he has been working with some COVID virus patients. And his wife is on maternity leave for a year right now, but she also works in ICU right here at the hospital, Royal University Hospital on campus here at U of S, University of Saskatchewan. And my other son, Gray, is 34, and he's married. His wife is a lawyer. They're both working from home now with the COVID virus. And my son has his PhD in biochemistry, and he happens to work with viruses and cancer research. So he has put in a proposal for a research for looking at a vaccine. So I'm very proud of that. And It just happens that's his area. His viruses with cancer research. So that's what he's doing. Yeah, and a little bit about, I don't know about what else to say right now. Research has been in mental health and mentally ill offenders, mentally ill disorders in Saskatchewan here. Right now I'm PI for a big dementia study in Corrections Service Canada that we're looking at. And my PhD was really looking at forensic nursing education, how it all evolved and developed in North America. So that's a bit about myself. And right now I'm working from home. The university is pretty much closed down. Everyone's to work from home, and all of our classes have gone online. And clinical has been canceled, so students are not back in clinical yet. We hope they will be in the fall. So it's been quite a disruption to some of the programs.
Arlene, perhaps you can tell a little bit about Saskatoon, about this wonderful city.
You were there.
Yes, Stephen was here.
Yes.
The city that I'm living in right now, I've lived in quite a few cities in Canada, but it's quite small, 246,000 people. But nice that it's big enough, but nice to still able to get around pretty good without too much traffic. So we're the largest city in this province. Our province of Saskatchewan only has just over 1 million people, and we're right in the very middle of Canada. It's a western province with low population, but a very good standard of living and a prosperous province with all of our resources. Yeah, and Canada itself is 37 million now, so we're only about less than half of Germany for population, but I think we're 28 times larger, and I think Germany could fit into this province about three or four times. Yeah.
It's really crazy.
And what I'm interested in when we talk about Canada is, before we go deep, my question to you is, I would like you to give us an insight in the Canadian health system. This system is known for a really high quality. Could you please tell us something about the health system in Canada in general?
Mm-hmm. Yes, I could. It's we have what our whole system is called is parliamentary democracy, whereas you'd be a republic. You're a republic there, union. Mm-hmm. And our whole system is where you have states, we have provinces and territories. So we have 10 provinces, 3 territories, and the capital is Ottawa. The city capital is Ottawa in Ontario. And with regard to the healthcare system, we have what you would call universal health care, and we were one of the first countries to have that. It was in the late 40s when actually the premier of this province, happens to be this province, was it's been quite renowned for starting Medicare here in this province, because farm families, he was finding that farm families were really had a hard time if they had a health condition, and so felt that everyone needed to have free health care. So pretty much it is, healthcare is pretty much free to everyone, about 70%, and then there's benefits with depending on which jobs that you have. And for myself and for most Canadians, it's 100% benefits, except for if we were going to have something that we didn't need to have done, like some kind of plastic surgery or that sort of thing, we'd have to pay for that ourselves. But 100% drugs, my prescriptions are paid for. all elective surgeries are paid for. You know, like if people needed my husband had a hip replacement last summer, and we don't pay out of pocket for anything like that. And then
Great.
That's great.
Yeah,
that's a treat for us.
And the same for having babies. No one pays to have a child, so that's very different than some countries. And now they have maternity and paternity leave. My daughter-in-law is on a year mat leave right now, and I think it's about 70% of her pay. And my son can also take, over and above that 1 year, he can take 6 weeks at about 80 or 90% of his pay anytime. Or he could share it with her as well, but he's decided just to take the 6 weeks where she's taking a year.
Okay.
Yeah, that's the main
Very
thing
great.
about it, I think.
Yes, that's really amazing. I think many of us wish that here are similar rules, but
it's not.
It's not.
Arlene, you're a specialist for nursing and mental health care. Well, in times of coronavirus, our nurses are massively burdened. They are called heroes of every day. People stand clapping on a balcony, but for applause and warm handshake, nurses can't buy anything. In Germany, this profession is almost miserably paid, and the profession of nurses is not particularly valued in Germany. In Canada, this is different. The nurses experience a special appreciation besides a high salary. How does it happen to all?
I was over in Germany in 2012, 2013, I think. And so I did talk to a lot of people over there, and I think I have sort of determined what exactly the differences are and how that evolved, from my perspective anyway. As I was saying, I'll have been a nurse for 50 years next year. And in my career, yeah, I'll be 70 this year. In my career, I've seen the changes myself and experienced them. When I did my 3-year hospital diploma, which they don't have anymore, they stopped that in the early 1970s. That was a 3-year hospital diploma. At that time, nursing certainly wasn't, the image of nursing wasn't as respected as it is now. The pay was very, very low. It was considered a good job, but not high paid. And then a lot of things happened in Canada and in society. In the 1960s, there was a real, that's when all the human rights movements happened, civil rights, especially in the States. And because we're so close to the States, we are really influenced by the United States. We kind of have the advantages and not the disadvantages of being as close as we are. We get all the media, but for some reason, we as Canadians sort of think we're better. I don't know why. We just
could we say it was the same situation like in Germany now?
Yeah. Yes, exactly. And so because we think our values are better, and but what happened was all of these human rights movements in the 60s, women's rights, civil rights, patient rights, and some would say that they don't know if that same trend in society happened in Germany at the same time, or some areas in Europe. I think it did in England, but maybe not in some of the European countries, just because of everything, And so there was a lot of class action lawsuits. There was a lot of investigations as to healthcare, especially for offenders. and nurses were, put in the correctional institutions because they felt they needed a higher quality of healthcare. But then what happened in Canada was that we have nurses unions, we have nursing professional associations, and our education, starting in the 70s, as I mentioned before, they were all moved, nursing programs were all moved to a community college base or university. So we no longer had that hospital-based education for nursing. And we had nursing unions who began to really, every one of us were a member of the union, of course. We all had to be, because we all paid dues. And we started to say, the thinking was, why am I as a nurse, even though I'm a woman, why am I not getting paid the same as a city worker or a man who I went to high school with and they never finished high school? Why is that when I have a 4-year degree? That's certainly not, we're not going to stand for that anymore. That was basically the thinking. And because nursing was 95% women then, certainly at that time, the ratio is a bit different now. There's a few more men, but not that many. And so we went on strike. So we went on 3 major strikes I can remember in the 1980s because we wanted higher pay. And we used to be always the same as teachers. And then I think in the 90s, since then, we've been even higher than teachers for some reason. We just are very much higher than teachers are. And so it was nursing ourselves that said, no, we weren't going to, we're not going to be paid minimum wage and have all this responsibility and everything else, that we needed equal wages to men. So it was the unions, the nursing professions. We have always had nursing professions where they're regulated with licenses. There's a National Nursing Association, Canadian Nursing Association, and then each province has their own provincial nursing profession as well, where we pay our dues and ethics and all of the standards and competencies are done at that time. And then the education really increased as well. We started to be 3 and 4 year in the colleges. By 1980, it was degree level. Everyone, entry to practice 2000 was the slogan, but even in the 80s, everyone was a degree prepared by the late 80s that was our bottom level of registered nurses, was a 4-year degree. And our master's program started in the early 80s, and lots of master's programs now. And our first PhD program was 1991, and there's about 20 now and about 65 nursing programs across Canada. And so with the advanced education, it brought us up to where we were considered equal to other disciplines of psychology, social work, or any other healthcare discipline, and actually considered better in that nursing with just a degree was paid about equal to a psychologist with a PhD. And so the undergraduate degree in nursing is considered by far the best degree to have, the best bang for your buck, what they would say, in that there's lots of jobs, there's lots of flexibility in the jobs of, where you work and what shifts you work. There's every choice out there. And the pay was considered much higher as well. So
and that's the point where the nurses in Germany are fighting for. But here in Germany, we are on another point, how you said it before. Do you think we in Germany can improve our system, or we are on a good way to create a system like in Canada for the future?
Yes, from just meeting Harold Haynard, who I got to meet in the 2012, and then Stephen a few years later, it seems that there's a lot
to
more.
say, Albert, the scientist of nursing in Germany. I said this for our audience, yeah?
What was that?
I don't want to, you said Harold. I only said it's Harald Kolbe. He's a scientist for nursing in Germany.
Oh, is he?
For,
yeah. Yeah.
Yeah.
Yes, he's amazing, and but I could see even just in the time since then, since I was over there in 2012, when I first met him, I think it was around 2011. I think there was just one degree program for nursing, and now there's a lot more, and so that's all changing too, and as soon as the educational level starts going up, then nurses, it all kind of goes hand in hand. They become more respected. They demand more salary. If we didn't have our unions, because we have so many numbers, we have a strong union, and so we went on strike and just walked out, and that's what we had to do. And the public were very much supportive of us in the 80s. And they still are, because they just didn't think it was fair either. And so so because of I think you do have to have a strong union to look after your work-life issues and pay. Then the professional associations, those were important too, to have those networks, and the educational level. So. And nursing in the universities, that's their big income, is because there's so many that they're educating. So of course, every university has a nursing program. Every one of them does, and it's usually their flagship program because of the numbers. Yeah.
Okay. Thank you.
Thank you. Okay, and before we come to the impact on the healthcare system in Canada, we would like to know what COVID-19 pandemic bring to you and the other citizen in everyday life.
Well, it came as quite a shock to all of us, and I think it was in the news in just after Christmas in January about virus in China. It wasn't taken very seriously, I guess, and we really get U.S. news as well as Canadian news, but until it started happening here, we didn't take it seriously. Until there started to be cases and deaths, and so the U.S. was really behind on this, and the reason was Trump, actually, and he certainly has, he's trying to rewrite history, but I think most everyone knows that he's always been such a liar about everything that most people can see through that, but he does have a following, unfortunately. So as soon as we started seeing and hearing about it in the U.S., Canada became very serious right away, and we had an state of emergency across Canada as soon as the first states did in the U.S., and we were more kind of prepared and put things into action, I think, sooner. So that helped us. But the cities that where a lot of international people come into, like Toronto, Montreal, and Vancouver, those are the ones that are hit the hardest. And places like Saskatchewan, we felt it very little, but we take it as serious as everyone else with the stay at home and closing down universities and businesses. But we've only had 5 deaths in total here in Saskatchewan. But for just individually, instead of getting ahead of myself, I better not get ahead of myself here. But I think that it's different for each person. I think it hasn't affected me too much because I like working at home. And I like teaching online. So, and I've always done that. So it hasn't been too much of a difference for me. It's a huge stress for anyone that's lost their job, that doesn't have an income, having to apply for all of there's lots of government funding and things, help available, but you have to apply for it, of course. And so, and both of my sons and their wives have got jobs where the money they still have an income. So it hasn't affected some people as much as others. And my father's 95 years old, and it really has affected him because he lives in his own house still, the house that he was raised in, really. And but because they've canceled church and because they've canceled choir, he's sung in the choir for 50 years. So then he doesn't have that social life anymore. And the Legion, the Royal Canadian Legion, is closed down, which is the veterans, which he's a member of. And it's a big part of the community there. So that's really affected him a lot. So we try to phone him more often, that sort of thing.
Yeah. Okay, now, of course, we are very excited to get to know something about the impact of COVID-19 on your health system. Here in Germany, it's so we want to keep the number of cases and the reproduction rate low by various measures. So far, we have succeeded very well in Federal Republic of Germany, so we have been able to avoid conditions such as those in Italy or Spain. What are taking for measures in Canada to avoid overburdening the health sector?
Yes, I have heard on the news just how well Germany has done compared to the other European countries, that they're quite a bit lower. And I think the things that we're doing are the same as there. Visitation to hospitals were stopped about the middle of March. Anybody that goes into a hospital now, it's a screening and a scanning and temperature taking, and all of the elective surgeries stopped. And so our hospitals here in this province are quite quiet now. There's been a couple of cases in the ICU, but only like a couple, and sometimes they might be positive, but they might not even have too many of the symptoms of COVID. They're in ICU for other reasons, that sort of thing, but they may be positive. So we've only had 5 deaths in the whole province, and we've got, as of yesterday, in our province, just 366 positives and 5 deaths. But in all of Canada, there's been 48,500 cases and 2,818 deaths. So Ontario and Quebec, those provinces, have had over 1,000 deaths each. And then BC and Alberta have had around 100, some a little bit more. And then the rest of the provinces have had like 5 or 6 or 7, that sort of thing. And some have had none, especially if they're a province where they're not getting a lot of international people, they don't have big airports, that sort of thing. So we do the social distancing. We've everybody wears a mask when they go out now, pretty much. Everybody's been staying at home. Yes. What's that?
Here too, since yesterday.
Everyone has to wear a mask. Yes.
Yeah. Now, well, I would say probably half are wearing masks. But if you go into a grocery store, then you're expected to wear a mask, and the same with the people that work there. And that only started in the last week or so too. Before it was hit and miss, and now it's more people are wearing them. Yeah.
And what do you think this situation does with people with mental illness?
Yes. it has really impacted them as well, in that that's been my focus area. I've heard that the admission rates are higher to the acute care psychiatric units in the hospitals. The social isolation has been hurting them. Certainly, it's been hard on offenders because they're not getting visitors, and a lot of their programs have been canceled. So it really, and they're afraid that they're going to get it and not be able to do anything about it, that sort of thing. So their families are really lobbying for them to be out of jail, which they have to really kind of think about that, because that's a real impact. We hear that apparently, I don't know this firsthand, but family violence is supposed to have been really raised or increased. There has been instances of hate crimes against Chinese people in Vancouver because, people saying that it started there in China. So, but these small little instances. Alcohol sales are up. They say people are drinking more now.
Yes.
And then at the same time, we've got an epidemic here in Canada for the last four or 5 years is the opioid crisis of opiate deaths. And that has, there's been 16,000 deaths in Canada in the last 4 or 5 years, since 2016, 14,000 deaths, about 4,000 a year die of opioid overdoses. And so at the same time the pandemic is on, we've had this epidemic, and some are saying, well, the epidemic is just getting lost. Nobody's even paying attention to it anymore, where it's still just as bad, So Canada has got that problem as what's going on as well at the same time. And so there's been some recent articles, and I've put them with the documentation that I've sent as to what they're doing about that. They're trying to make the, of course, the harm reduction policies, they're trying to even increase those to make more safe places, and that the drugs are safe too. And they think that if the physicians increase the prescriptions for some of the narcotics, that it'll be less of people getting them off the street that aren't safe. So that's what they're looking at doing about that in terms of mental health. And but they're still getting their subsidies. Those are people that have a mental illness do have government assistance, so that income is still there for them. But they're frightened like anyone else, that depending on how much they understand it. Some really understand it, others maybe don't, understand really what's going on.
Sure. Okay, what interests us now? What do you have some tips for not only for mentally ill people, how we are able to get through the isolation measures better?
Yeah. About even a month ago, a very good website came around. Just I think I just got it from someone, a friend of mine in Ontario, and I've put it in the documentation here. It's Worry and Anxiety, and it's a free guide to living with worry and anxiety. And it's translated into many languages, and I've put the link for German here. But mainly what they deal with is what worry is, and what worry feels like, what triggers worry, and when does worry become a problem, and then how you need to look after your own well-being and finding that balance. And if you can't do anything about it, to try to let it go. And then some of the tips that they're saying is to have a routine in your day, stay mentally and physically active, of course, practice gratitude, being thankful for the things that you do have, notice what the trigger symptoms are for yourself about worry, and rely on respected news sources and not ones that are exaggerating it or making it or minimizing it, which Fox News does. And then there's tips. There's a really good link that came around from a faculty member that used to work with us here at U of S, and she's in Edmonton now. And it's how to help seniors feel less isolated. And she's listed a bunch of tips, and I've included those here too. And mainly they're to stay in touch with seniors by phone and letters. A lot of them don't have email, but certainly phone and letters. Do things as much as you can virtually if you can. And sometimes delivering food really helps, and really being thankful to the support workers or people that are working in the long-term care homes, and sending them thank you cards as well. And often suggesting that older people like to be helpful too, and for them sometimes it helps them if they can help other older people by just staying in touch. So I've included those links, but and I think a lot of those, I think, is what we've kind of done too, is just tried to keep things as normal as possible and just carry on, I guess.
Carry on, yes. Carry on is a good word for my next question, because I would like to ask you, what do you think? How does the COVID pandemic goes on? How do you think the development will be?
I think
Can
there's
you say something about this?
Yeah, I do have thoughts about this, and I think what everyone is thinking is it's going to be a different future. We're going to be very used to wearing masks and wearing it for a long time. With regard to the university and education and healthcare, with the university, I think online, we already had lots of programs online. Our master's and our PhD program are completely online. And so that continues, but we're going to have more of our undergraduate programs online as well. So that changes things, and that I'm sure will continue. With the healthcare system, I think that there'll be changes there, as well as to being more conscious about cleanliness, although SARS really picked us up a notch as to always having sanitizer around when SARS happened. I saw that being very different in some countries that where they weren't as affected by SARS. I used to take students to Australia, and really noticed how they didn't go through SARS the way we did, and so they didn't have sanitation or sanitizers around in all the hospitals the way that we have had for years. And I don't think there'll be it'll be a long time or until we get a vaccine. So it'll likely be 2 years before we have things like university convocation. You can't have 700 or 800 people in an auditorium, you just can't anymore. And all of the big sporting events, I don't think anybody's going to be going to those anytime soon until there's a vaccine. And but one of the big things that I think is going to happen, and you won't hear this on the news or anything, but I believe this was starting to happen before the pandemic, is that we're seeing the demise of the United States as a world power. And I think that's what's going to be the biggest thing that's going to happen. It'll come sooner because of the pandemic, because of how they've responded. Their death rate is 58,000 people in the United States as of yesterday. And Trump has ordered everyone, just last evening, has ordered that all of the people that work in the meatpacking plants across the United States to go back to work. And some of them have 1,000 positives within one meat plant. So the biggest areas have been the long-term nursing homes that have been affected, the prisons, and big factories where their people are working close together. Those are the three areas that are most affected. And but I think what's happened in the U.S., and we've all seen it, their economy has been great, but their deficit is in the trillions, and they just keep making money. They're not kind of dealing with their deficit. But with the current government, they've lost respect around the world. It's shameful. It's kind of more of a populist, and he's very supportive of dictators. And so he certainly has changed the Republican Party. And from a psych mental health perspective, anyone would say, and that has a background in psych mental health, that it's a narcissistic personality disorder. You can't have those kind of people in charge in leadership positions. You just can't. And so, so many things in the U.S. has to change. They have to have a universal health care system. They've got to do that. They've got to start taking science seriously and global warming, which they haven't. They've pulled out of every NATO and every trade agreement, and they've just lost the respect of the world. And I think there's going to be some major changes because of the pandemic that I think will bring it on sooner, when even his base realizes that it's caused death to a number of its citizens. And they've been for years, they've been in a mode of war, of waging war with, Vietnam and all of the other different countries that they've been in, Afghanistan, and they just can't. They can't do that. It's just not right. It hasn't been right for years, and the American military has been big business for them, and that's got to change. They need to be putting their money into poverty and into things that make a difference in life. So I think that'll be the big change that'll happen from the pandemic, that there'll be a realization that they're no longer the world power, and they deserve to be taken out of that position, actually. So that's my own perspective, certainly not from the University of Saskatchewan. That's my own thoughts.
Thank you for sharing your thoughts.
Yeah,
Thank
okay, thank you very much. René, do you have still another question to Arlene?
Not at the moment, no.
Okay.
Do you have another question?
No, I think we are at the end of our interview now. Arlene, thank you very much for your time.
Thank you very much.
And your expertise. We wish you all the best, and above all, good health in these difficult times.
Thank you very much.
You too. How has it been there for you?
In our situation in Germany are very much situations that were similar, like in Canada, the mask situation, the illness of people, the situation how many people handle this. And I think what you said is that many people have the chance to go inside and to think about everything in this silence. Mm-hmm. This is what I think. What are the results of this COVID? Yes.
Yeah, sure.
What do you think?
Yeah.
I think it's a good situation to be calm and to be slower in everybody's life. And I think people are very disciplined in Germany.
Yes.
And it's really great to see this, that all these people are really pay attention to these rules, and
we have two groups. We can say we have two groups.
Yeah.
We have the one group who says yes, thank you for the Maßnahmen, for the measures, and the other group who says, well, it's only bullshit, and I don't believe in this.
It's only little flu.
Yes, two groups. But everyone complained.
Yeah, and I think Canada's been like that too. We don't have any of the protests against it what the U.S. has. There hasn't been big protests against it, but I'm sure there are people that are not taking it serious. They're wanting to get back to work, whether they should or not, that sort of thing, but not to the extent that they are in the United States. And but that self-reflection that everyone's doing, I think that is certainly very true. And I didn't mention that. Everybody has really reflected on their life and how maybe we've just been too fast and not thinking about things. That they say more people are getting their wills in order and that sort of thing. Lots of jobs for lawyers with everybody wanting to do their will, for their family. And they say that's really increased because I think people are just reflecting on how we're doing things. And some of the best news that comes out of the U.S. and Canada is how do we need to do things different in the future? Yeah. And be more prepared for these kind of pandemics, because they probably will happen again. It won't be the first or last time. Yeah. And it could be even worse. So to be prepared and to take it seriously. And certainly our generation now, or the people that are living through this, will certainly the next time take it more seriously and react faster than what we all did. We all could have acted faster, I think. But just being that 2 or 3 weeks ahead made a difference, because we got to see what happened in New York City and what happened in Italy and Spain. That was all on the news. And so when it started to happen here, then finally we reacted. But just being 2 or 3 weeks ahead of that made a difference in a lot of places over here.
Absolutely. Yeah. At the beginning, the people here made jokes, COVID, not in Germany, in China, not in Germany, and now the situation is another situation. Now it's very, they are taking it serious.
Yes, yeah. And thank goodness for the media and the communication that we have in this day and in our life, that, because that would have been very different 50 years ago. I'm sure it wouldn't have happened as that people could really see and understand what was going on so quickly without the type of media and television and internet that we have, because it makes us kind of realize just what it was like in 1919, or with that last big pandemic then,
Spanish flu, you mean?
Yes, yeah, the Spanish flu that we right after World War I. I don't think we all have heard about it historically, but we never really, because we haven't sort of SARS and Ebola, and N1H1 were all starts of it, where we started to sort of see some changes, but not to the extent of this, Yeah.
Sure. Yes, I understand.
And HIV, when that came in, all of the different HIV fears, people didn't know how it was transmitted, and didn't know how to, nurses didn't know how to care for people with HIV. And we saw, and I was working in the correctional system then. I'd worked the first 10 years of my career, I forgot to say this, I worked in an emergency department, in a big emergency department. And then I did a real switch to mental health. And when I worked in corrections, we saw HIV in the jails far before they ever came into the hospital because of that population, right? It's high risk for HIV, hepatitis, TB, that sort of thing, all of the infectious diseases and staph infections. So we learned as nurses how to isolate and how to look after people with HIV in jails before they were into the hospitals, and then of course none of us knew exactly what to do, and isolated too much when we didn't have to, that sort of thing at that time.
It's a special situation in prisons. This is a lot of pressure, this mental pressure for all these offenders, and it's a very difficult situation for people who work there.
Yes, yeah. And I think with this pandemic, it's not the staff fearing that they're going to catch it from the offender. It's the other way around, because the offenders are fine. The only way they're going to get it is from the staff coming in. So it's not that they have it, they're not the problem now, as with some, infectious diseases of the past, that it's a completely different scenario, isn't it? And so that's why and they're a vulnerable population in isolation. So that's why the families are really pushing for them to be released, because they're fearing for their safety there. And so far in Canada, we've had some positives within prisons. They've tried to deal with it. There have been some people that have been released, but the federal system, where people are there for any crimes that are over 2 years, they haven't had. They've had some positives, but not the pressure like what there is in the U.S. to release them, or not the problems there. So they think most are going to be okay in Canada. We haven't really had huge outbreaks like they have in the U.S. Among the prisons, but certainly the nursing homes I think half of the deaths in Canada, they were saying half, are people that were in nursing homes and long-term care homes. So a half of the deaths were from that. So that's significant, isn't it? And so that's the other thing I should have said too, is we really have to look at long-term care homes and how the nursing there, and our long-term care homes and nursing homes, they can be run by the government, but they also, most of them are private. And so there might be only one RN on every shift for medication, and they might not even be an RN, it might be an RPN. Which is the one grade down, but they can administer medications. So they're paid very poorly in the nursing homes, and it's often immigrants, and it's often people that don't have any education in nursing that are doing most of the care, because they're the ones doing the changing, the getting them up to the washroom, feeding, that sort of thing. And most of the care in the nursing homes are done by uneducated staff. And because they don't have benefits, and this is around the world, they don't have benefits, they don't have full-time positions, so they work 2 or 3 places. So if they're sick, even if it's COVID, they keep going to work because they're afraid of being fired if they don't go in, but then that's who's likely has been spreading it. So that's the other big thing that has to be looked at. They have to have a higher level of care provider in the nursing homes. They need to be paid at a higher rate, and they really need to be watching things like that, because the pandemics have just gone through the nursing homes. And so probably that should have been my answer for the last question. I just wasn't thinking about that at the time, but that's really what needs to change in around the world is the care in the nursing homes. Mm-hmm.
Yeah. And in Germany, my personality topic, my mom, she's in old parents' home too, and I can't visit her since months, since I think 4 months.
My grandma's alone too.
Yeah.
And yeah, since March.
Since March, yes, beginning of March.
Beginning of March, and they are alone. No one can visit them. No one can help them. It's a big problem. And for the mental situation, it's isolation. Huh?
Yeah, sure. I'm speaking with her at telephone all the time, but she's always depressive, and she say this isolation, it's not good for her mental health.
Yes. And that's and my mother-in-law, my husband's mother, is in a very nice elderly living situation now, but again, no visitors, and she really feels the isolation, and if she has to have a visitor, she can go outside and visit them, and all of their meals are in their rooms instead of going down to the dining rooms. So she really feels that social isolation too, and loneliness. Yeah, loneliness is, yeah.
And the point is also that there's no day where you can say then it starts again, then we can see each other. Everyone has a big question. No one knows when do the things start again. That's the problem too, I think.
Yeah. And what has happened here in this province, actually, they've started opening up measures, and that's going to start the 4th of May, where there'll be, you can make dental appointments, doctor's appointments, and they're saying now that family members can see each other again, like in groups of family or close family, whereas we avoided visiting my son, who's right here, the one that works in ICU, who is right here in this city. He lives right here in this city, where my other son lives in Calgary. And we haven't seen them for a month. And they came over 2 evenings ago, and we visited. And they're saying that they really feel it's okay for close family members to see each other, or maybe close friends to be able to visit and eat together, that sort of thing, as long as you keep it to just a certain little group of your closest family, because you have to. And now the weather's starting to get nice, and everybody's wanting to be outside more. So we're seeing a lot more people out on the streets, just because winter just finally has gone, and our snow just went last week. And so now we're starting to really want to be outside. So things are changing, and but our province is really, really low, in only 5 deaths, and we never really, the curve was always sort of flattened. We've had control over it. So our province is very different from Ontario and Quebec, and very different from many places in the States. And I hear that things are opening up in Germany as well.
Sure, that's true. Even in Ruhrgebiet, we are in this area. This from Harald Kolbe, and this area is, I think, 4.5 million people living here on really narrow place, and it's big danger in cause of virus.
Yes. We can also say that in hospitals there are beds free. Also the signs are not as bad as in other countries.
Yes, yeah.
We have patients from Italy, from Holland, from the Netherlands. France. Yes, in our hospitals.
Oh, really? Wow.
That's fine. Yes.
Yeah, sure. Of course, intensive care, they prepared everything, and now half of these beds are empty.
Yes.
We had 33,000 beds intensive care, and that is really very good. And I think we are on place 2 or 3 after United States. And now we have half of these beds are empty, and now we can take patients from Italy, France, from another European countries.
Oh, I didn't know that. That's good to hear. Yes, we've got lots of beds in some of our provinces, whereas Ontario and Quebec are still don't feel that they've had the peak yet. And but in other provinces, the hospitals are just about empty, and the ICV, the workload in ICU is the beds. There's lots of empty beds there too. So, so it just depends how dense of a city that you live in, and that makes a difference. But that's great. I didn't know that patients were coming from other countries to Germany for hospitalization. That makes sense, doesn't it?
Yes. I think it's a very important time to help each other. Every country.
Yes.
Every people to help each other.
Yeah.
To go together through this situation.
Yes. Yeah. Well, that's great.
Oh, thank you again for your time and for your thoughts, for your opening. Yeah, it's a big honor for us that you spent such a long time with us. Thank you. We are very excited to publish our interview.
It made me kind of think just what my thoughts were of things, and I'll sign the document that I sent you, and I'll move that the bit I said about the long-term care homes. Maybe I'll add a little bit about that under number 8 or under that last question, because I should have really said that, and in there, as well as what I said about the U.S. But and just take what you want from what I've sent. There's a lot of information there, and you won't want all of it, but it gives some references and some points there that might make it a little bit easier when you're writing it,
Oh.
Wonderful.
Right.
We will broadcast in internet, this on YouTube and social media, and
send it to you too.
And we will do with subtitles in German, that not only people can speak English are able to look this, to watch this.
Yes.
Yeah. And if you want to delete anything, I guess you can too. So yeah.
It's not necessary, I think.
I don't.
Only our.
I don't mind saying my opinion about things, and but that's the nice thing about Canada. We're able to say what we think, and not worry about that. And I'm close to retirement anyway, so
it's really great.
Yes.
I think it's good to have your own opinion about things, and but it certainly has been 2020. Well, started in 2019, but this has certainly been a life-changing event, hasn't it, for all of us? And we're not through it yet. The impact is going to last for years, they say, of this, eh? Yeah. We don't know just what the impact will be, I'm sure. They're expecting a lot of cuts to university programs and jobs, and unemployment rates are very high. So it could mean a real difference in, well, the economy already. We're not even thinking about that yet, but that's going to be a huge impact, isn't it, for around the world?
Yes, that's all.
Yes, that's all. And and we wish you really the best and good health and nice greetings to your husband, please.
Yeah. Thank you. Nice to meet you both as well.
Thank you very much.
Thank you very much.
Yeah?
Thank you, Arlene.
Bye.
Bye.
Okay, bye-bye.
Vielen Dank fürs Zuhören. Wir hoffen, die Podcast-Folge hat Ihnen gefallen. Wenn Sie noch Fragen an uns oder die Experten haben oder mehr über unser Kursangebot erfahren möchten, dann melden Sie sich gerne bei uns. Die Kontaktdaten finden Sie in den Shownotes. Bis bald!